All right, you guys, we are here with Dr. Jessica Shepard, and I couldn't be more excited. Hi, Dr. Jessica.
Hi, how are you? This is exciting.
I'm well. So this has been I've been asking you to be on my podcast for like a year. And I think
Don't
this
tell
timing,
everybody.
I think this timing is perfect. So I have followed you for a very long time. Just you guys have to follow her if you're not already. The most down to earth, the most kind, and the most, I feel like, well put together physician in this space to make us feel like nothing is out of reach.
That I love. It's that last part that nothing is out of reach because, when I speak to my patients or even just my friends, and when I meet people, is really for people to understand that their journey and their scope of how they see themselves is still a way to get to that end goal. And it's not like this one template that everyone has to follow. And that's why I love options and variety and different ways that people can do things to execute the goal.
Yeah, I love it. And so we are here today. It's September. It is perimenopause month. Is that right?
It is
Okay.
Perimenopause Awareness Month. And then next month is Menopause Awareness Month. So it's back to back, kind of like menopause and menopause are back to back.
Yeah, right. And you have a book coming out. So we'll talk about that. And that's coming out in October 1st. So we'll talk about that at the end. So I just want to introduce you really quickly right off your website. She has a brand new website. I'll link that up here too. Is JessicaShepardMD.com. And it's SHEPHERD for those of you for spelling purposes, because I know it can be spelled differently. I've seen it. I'm like, that's how you spell it. So Dr. Jessica Shepard is a board certified OBGYN, wife, mother, on-air TV expert, CEO, business owner, and entrepreneur dedicated to pioneering women's health and longevity during menopause, and beyond.
Yes.
And on here, you put at the very bottom, I'm here to remind you that life doesn't stop here. Welcome to your most vibrant chapter yet. And I get chills when I read that, because that statement alone, I think, speaks to your entire mission. And
it is my mission. I think so many women are like, either they felt that someone put them in this category, or they feel like how society is structured, what their worth is that when you reach menopause, after that, it's kind of like the wheels fall off. And I'm like, absolutely not.
Yeah. And I love it. And I think you share a lot of your experience on Instagram, and kind of the things that you're going through, because not only are you educated in this subject, and you've been talking about this for all of the days since I followed you, before it even got really buzzy around.
Thank you for saying that. Because, I love to see that menopause is fashion forward, if you want to call it. But this has been something that I've been talking about for the last 5 to 7 years, is really this transition. Yeah.
Yep. I mean, I think it's maybe been 2-ish years or maybe 3 since I followed you. And that was one of the things that I learned from you, was almost the whole word of perimenopause. Not that I didn't really know what it was, but it's still kind of new. So I really wanted to get into that, because I love the conversations around like aging and women. I wrote a bunch of notes down here so that I would stay on task. And it's not kind of gloom and doom anymore. However, with anything else that gets a lot of attention, there's a lot of misinformation.
Yeah.
And I hate to say it, but in the wellness space, a lot of taking advantage of people's either lack of knowledge or just their kind of general feeling of wanting to feel better and almost hopelessness.
Yeah.
So I do love the conversation, but that's why I wanted you here, is to kind of help clear some space, and give us some direction, and hopefully maybe a little bit of answers to some of those questions.
Yeah. Let's do it.
Okay, awesome. So first of all, let's start at the very beginning. We're going to start very basics. You and I both know, even from an exercise standpoint, we do the basics over and over and over, and that's what makes us good. Yes. So let's talk about the basics. What is perimenopause, and what is menopause? What's the difference?
I love this question, because I feel that most women stay in this space of like, there's a difference, or what is this word versus this word? Are they the same? And kind of the way I look at it as a gynecologist, so kind of taking it from the clinical standpoint, is the perimenopausal timeframe really is a variable timeframe. There's no like discrete time in which someone starts it or ends it. Now, it is the stage in which we start to see, from a hormone perspective, of estrogen and progesterone, but namely estrogen, declining over just like a slow course of time, which can last anywhere from 3 to 7 years. But it could last longer or it could last less, which is why I'm like, there's no definitive to when it is. Most times that will happen in your 40s.
Okay.
And so you start to see this very subtle decline of estrogen over those course of years, which then creates kind of these changes in whether it's your bleeding pattern with your menstrual cycle or the intensity of it, but also some other symptoms. So, a lot of people will be like, just like over time, I've noticed that my sleep is not great, or I had a hot flash, but was it a hot flash? I don't know, because it didn't come back again for some time. And then over the course of time, as estrogen declines, then you start to have an increase in these symptoms and then more infrequency in your period until you actually get to menopause, which I can define now or later, it doesn't matter. But that really is that time frame of perimenopause.
Okay. And then what is menopause?
Yeah, so menopause is a very clinical term, and that's why it's sometimes hard for people to understand it. Is menopause really is like when, healthcare providers and doctors are talking to each other. When we use that word menopause, it really means that this woman that we're speaking to or about has gone 12 months consecutively without a cycle. So
Okay.
it really is when we can, like, with definitive authority say, oh yeah, this woman has gone 12 months without her cycle, or she reports that to, her doctor. We then know, yes, she is menopausal. So menopause to me really is a day because it just defines that 12 months that they haven't gone without a period. Because after that, she'll be in menopause for the rest of her life because she will not have any more periods after that.
Right.
So that really just means the ovaries at that point, for 12 months prior to that, they have gotten to the point where they are not releasing enough estrogen to elicit a period. And then after that, you're postmenopausal because you are beyond menopause.
Yeah. And I think that the general message, I think, of my age group, at least it's about your age group, is, you hit menopause and then that's it. Your time is up. And
Right.
that's the message I think
Society
you're
tells
changing.
women. I mean, you even see that in, like, the job sites and even
Yeah.
Hollywood. How many actresses have you heard that they can't get jobs anymore because they are considered old? And
Yeah.
literally, they can literally be 51 or 52 and they can't seem to get jobs anymore. It's really weird how the time, like that clock that's ticking on women, as soon as they may reach out of their reproductive years, the rest of society is like, okay, thanks so much. You won't be considered for, the leadership role in this, job, or you won't be advanced in your career because you're of this age. And I think
Yeah.
that's kind of where I love to stop the messaging to
Mhm.
redirect it. Because then, people take it in on themselves that they're just like,
Yeah.
oh, I'm not worthy, or I'm not good, or I can't do this because of my age. And I'm like,
Yeah.
nah.
Yeah, I love that. And for somebody like you, like I said, when you are on social media, you're very real and you just feel like a friend, and like you're one of the girls just hanging out, and you're just like, hey, you got this. And that's the message, and that's what I'm drawn to. And that's kind of the community that I love to build too. But you are correct, is that, and this is one thing that I teach to my patients. I'm a cardiac rehab director as well. So I teach my patients and my clients alike, like, you have to feel worthy. Number one, you have to feel worthy. Otherwise, nothing is going to work. And that feeling of worthiness, often people speak into that. Oh, well, you're done. You're washed up. You're too old. And then we, like you said, we internalize it, especially as women.
Yeah, we sure
We want
do.
to take it in because we don't want to show any weakness, and we don't want anybody to be bothered by our problems.
So weak and humble, right? And I'm like,
Yes.
no, it's time for us to speak out and say, no, this is actually one of the best
Yeah.
chapters of my lives, because guess what? I can focus on me. A lot of times we focus on so many other people, our families, career, or kids, if you have kids. And then after that, if you think biologically, if people had kids, most of them are gone off now. Your marriage, it's kind of like there or not. And so now you actually have time to spend on you. But a lot of times, because we're not told we can, we give up.
Which is kind of crazy to me, because I think back to my 20s and I think I had nothing. I don't even hardly have anything figured out now in my 40s. But then, for me to have the biggest, best roles in a career, there's no way, because
No.
now, like, we know who we are. We know what we stand for. And we know what we don't stand for at this age. So I'm excited. I'm excited for these conversations for sure. So I want to get to, and again, this is going to be very basic. So these are a lot of the questions. I don't know if you got any questions yesterday. I only had a few. And then across the board for for us, again, very basic, if we can just dumb it down and come to the very bottom. You mentioned hormones. So what exactly are the hormones that we should be looking at, and what are they?
Yeah. So first of all, hormones in general are chemical messengers. They're really just like the mailman in our bodies that send out messages to all the different organs on how to function. So it's basically like the foreman in a factory who in the beginning of the day is like, okay, you're in charge of this, you do this today and you do this.
Okay.
So estrogen, progesterone, and testosterone are probably, when we think of a menopausal kind of like phase and perimenopause, those are the three that we look at in the decline of, in what's going to occur then in what messages they usually send. So if they're not able to send the messages as readily as they were before, that's why we start to see some of those changes, which we'll go through in our whole systemic body, start to occur. So estrogen is probably our like namesake of like, what is the thing that makes us vibrant? What is something that women have a lot of that men typically don't have? Men have estrogen, but estrogen is our like, this is your like joie de vivre. This is your best asset that you have.
Yeah.
And so when that starts to decline, we see a lot of changes happen. Progesterone, I like to think of progesterone as like our comfy hormone. It like hangs out. It always needs to be there, but it's always like, I'm going to go sit over in the corner in that beanbag and just chill, but I'm still doing work.
Got your back when needed.
Chill. I can be back. And then testosterone is the little like fire engine in the room as well. So estrogen is going to be like the one who takes up most of the space at a party. Progesterone, we already talked about, in the corner, just like vibing. And testosterone is kind of like the person who's like small but mighty. Like you're like, why can I always hear the person in the room and they're like this tall? And that's testosterone because it's a very potent hormone, but we just don't have a lot of it. Men have a lot of testosterone. We have testosterone as well, but just smaller amounts. So it's like the person in the party who you're like, you're talking a lot and you're taking up this much space.
Yeah. Also, I love the way, and that's exactly how I wanted you to put that, is it's like you're talking to a patient right now and you're educating us on what are these things that we're looking for. So we talked about menopause, perimenopause, what are hormones? Now, at what age could somebody likely start going through perimenopause?
Yeah. So that classification can be anywhere from 3 to 7 years, but I have a lot of patients who like late 30s, early 40s start to have subtle changes that you're like, listening to your story, I think you're kind of coming up on this slight decline. It really hasn't maybe hit kind of like a steep slope, but from the symptoms that you're mentioning, I think that you're entering that phase. So I would say when we look at like majority of people going through perimenopause, most are not going to go through it in their late 30s, early 40s, but it doesn't mean it can't happen then. And then you have most who are going to start to feel more of their perimenopausal phases, maybe through, mid 40s. So like maybe 44 through like 47. And then after that, we call it late perimenopause, because that's now when we're kind of like coasting into our early menopause. And that's where the symptoms could sometimes intensify or be more severe. So it's kind of more right. So it's like this early, mid, and late phase for most. I have had women who either they start very early and they have a really rapid decline, or women who haven't had a symptom, like seen a symptom, know what a symptom is, and they're in their mid to late 40s. So again, I'm taking it in context of what most appear as, but there are going to be outliers.
Sure. And so that's that period. Now, when you're in the younger, like, okay, so for time's sake wise, you're going to have a whole list of symptoms that are in your book.
A whole list.
And she's going to have some solutions in that too. But let's say somebody is experiencing some of these symptoms, and maybe that is a little bit of weight gain in their midsection, maybe feeling a little more tired. Maybe their period is maybe heavy 1 month, but normal 1 month. So as that kind of trickles in, I guess, to that late perimenopause, can some of those symptoms go up and down? Like you feel like, oh, I'm not dealing with anything 1 month, and the next month you do?
Yes. And that's why I think in the shift of how we treat perimenopause now, which is so much better than even when I trained, is still lending an ear to what these women are going through and then helping them decide what they would want to do to offset it. Because you still have the option at that point, if you're early, to take birth control, contraception. That can help because it's going to help buffer some of those things with the hormone balance and also protect from pregnancy, because most likely, obviously, they're still having their period, into women who might be a little bit further into perimenopause. And we're like, maybe we'll start you out on some HRT, because hormone replacement therapy cannot be used as contraception. So those are some of the nuances of when you start to have symptoms, how severe they are, and then where you are as far as age to decide what is going to be the best thing for you as far as management and treatment.
And I know you talk a lot about in your book, and just your general message is, no matter if you're taking whatever, and we'll talk about that in 1 second, you
Yeah.
still have to exercise and do these lifestyle components.
When I tell you, that has
Mhm.
to be, and that's why I love watching when you tag me and you show me what you're doing. It's
I
the
like accountability. I'm
Yes.
here.
It's consistency and the accountability of doing these things every day. It's kind of like the piggy bank. You want a lot of outcome and benefit in the end, but every day you just got to be putting in a little bit here and there. And then, 10 years, 15 years, your piggy bank is full.
Yeah. Yeah.
Yeah.
That's my motto, is consistency over intensity. After I got out of the bodybuilding industry and world of
Mhm.
myself competing, I'm still kind of involved on the outside, but
Yeah.
um, I I just had to find a new way to work out. My hormones alone, and I still have to set a whole appointment with you. She does telemedicine. I've sent some people to you, and
Yes.
and I and so all of that, but I had to find a new way, and it was really
Mhm.
just felt good. Like a little bit every day felt great, but I want everybody to know that we're going to talk about this conversation from the understanding that we just expect that everybody is kind of understanding that we have the lifestyle component already,
Mhm.
that we're exercising consistently, that we're eating generally well. Again, more details in your book. But we're just going to kind of talk about this as everybody
Mhm.
already is doing that.
Yes.
I think
Yes.
that would be good
Because
because
by the end of our conversation, everyone will be doing it.
yeah. Right. And so I wanted to ask the question too. So you have your estrogen, your progesterone, and your testosterone.
Yeah.
And are some of those numbers that, let's say, you're reading, and we won't even get to numbers because that's
Mhm.
something as a physician you would deal with somebody personally. Um, can some of those numbers be reactive? Meaning, let's say somebody comes to you and they are not exercising, they're not eating well, and you're like, look, girl, let's do these things first for a few weeks. Let's
Mhm.
put these things in place. Come back. Does the numbers come back reflecting what they've done like a month prior? Does that kind of make sense? Like, can you work on lifestyle
Mhm.
things, redo blood work, come back to you and see if your symptoms have changed?
There are multiple answers to that.
Mhm,
One, not everyone's number is gonna change significantly.
mhm,
What you really have to balance between that is, yes, I'm looking for a metric that would be a
mhm.
number on a lab that
Okay,
would change. The other thing we wanna make sure is what is the symptom resolution,
okay.
or what is the improvement in a lifestyle factor that we were looking for, right? So it has
Mhm,
to be a little bit of balance of both.
mhm.
Because inadvertently, because you're still ovulating, because you're still having a cycle in the perimenopausal phase, your body is still going to adjust to the levels of estrogen that it is when it's in a certain phase of the menstrual cycle, and progesterone, and vice versa. But the point is there something that is so severely out of range that we're looking
Mhm,
for a change to come into normal range? And then what
mhm,
is the symptom that was going along with that that we can rectify? And so when you were talking about like belly fats, right?
mhm.
So it may
That's a
not,
big
it may
question.
draw.
We wanna go over that.
Yes. So I may draw labs, 3 months later from someone who's like, "I'm gonna do intense workouts for 3 months." And you may not see a significant change in, like, their estrogen or progesterone levels, but what you will start to see is the change in how their body form appears. Like, if I say, "You know what? I'm gonna now measure your muscle mass compared to your
Mhm,
fat mass," that
mhm.
is where you might see actual change rather than, "Oh, now arbitrary numbers, you went from an estrogen of 50 to 25."
Yeah,
Yeah.
yeah, yeah, awesome. That's kind of where the conversation of the HRT, so HRT is hormone
Mhm.
replacement therapy, and that's one option that you could offer somebody based off symptoms. So you're treating each person based off their symptoms.
Yeah. You have
Yeah.
to make sure and where they are in their stage and phase of life. I mean, I
Mhm.
have some 40-year-olds who are still very consistent with their cycle, maybe
Mhm.
still having, sex, unprotected sex, and there is a fear of pregnancy. Is
Mhm.
their likelihood of being pregnant decreased? Yes. Can they still get pregnant? Absolutely. And so
Yeah.
for those women, I have to say, okay, where are you in the stage and phase of your life? And is contraception maybe more in the priority list in addition to helping with hormones? Or is that kind of not a priority on your list? Because of your activity or because you have another form of birth control, then we can use HRT, right? So it has to
Okay.
be a really in-depth conversation because
Mhm.
I would say a lot of women may think, oh, because I'm 43 and starting to have some of these symptoms, even though they're having cycles still and they may be infrequent, I'm just going to get HRT to relieve my symptom and I'm not going to get pregnant. And then we're like, you can still get
That's not
pregnant.
how that works. No, that's really good to know because some people think that. I think I've even heard the
Mhm.
conversation of men and they're like, "Oh, I'm on TRT. I can't, I can't get somebody pregnant." I was like, "I don't think that's how that works." But, have
Mm-mm.
fun.
I mean, if they're like knocking them out because they're on like some crazy numbers of testosterone, fine. But could it still happen? Like world of absolutes, yes, it could still happen. It's less
Yeah.
likely, but it could still happen. Hmm.
Yeah. And what causes, I guess, that was one of the biggest things. So I guess one of the questions I have to ask this question for one of the girls in our community. Can one of the symptoms be heart palpitations, anxiety, that kind of thing in perimenopause without kind of having all of the other tests done, cardiovascular, all of that? But what is that some of the symptoms?
Yes, one of the symptoms is anxiety. So when we think of then our neurotransmitters, which is like our
Hmm.
serotonin and our dopamine, which has a lot to do with how we respond to things or how we feel to certain things, which can then offload to either depression and or anxiety. Because of the close connection between neurotransmitters and hormones, again, when you start to see these fluctuations in your estrogen and progesterone, that therefore impacts our neurotransmitters and you start to see possible potential fluctuations in those, which can cause and lead to anxiety.
Okay. So is that a reason why a lot of times, a lot of doctors will prescribe like SSRIs, like
Yeah,
antidepressants?
yeah,
Mhm.
yeah. And so again, see that kind of like we're pulling away. Well, they're anxious, so I'm only going to address their anxiety as like the actual diagnosis. But when you kind of like pull away from that and say, well, we might have some fluctuations here in her estrogen and progesterone and testosterone, which may be offsetting this. What if we kind of rectify or help support the hormone portion of it? Then you start to see a decrease potentially in the anxiety level as well.
Okay. So it's kind of just working with your physician and seeing
Yeah.
how you feel and being
And
your
then
own
also,
advocate.
yeah, and then what women are willing to take as a form of management. Because some
Mhm.
women really, and I want to say this, actually, I should have said it at the beginning, is as much as an advocate that I am for hormone replacement therapy, I will never tell someone that they must take it or that if they decide not to take it, that they're in the wrong. Okay. I
Yeah.
will always tell people this is what the benefits are and this is why I think you should take it. But if someone's not ready to take it or they don't want to, it should never be a shame game. And so that I wanted to make sure I said that. But
Yeah.
also, some women are like, you know what, I'm okay with taking an SSRI or it works really well for me and I'm
Mhm.
not interested in HRT or balancing the hormone part of it, then that's okay too.
Yeah.
I just want to give people the option of knowing
Yes.
one what might cause the other and what they can do as a solution.
Absolutely. And I think it's important to work with your physician and I've heard you say multiple times, like you are an advocate for getting second opinions if somebody
Mhm.
isn't really on your side or you feel
Yeah,
brushed off to the side or you feel not heard at all.
because
Um,
that's how you're going to get to actual outcomes is when, like you said, the accountability part of it, or you feel like this person has your back, or the
mhm.
conversation is going like two ways. That's where you're going to get outcomes. So if you're just like feel defeated every time you walk out, find someone else.
Yeah, good idea.
Mhm.
Yeah, because not every trainer is good for everybody, and not every
Right.
physician is really good for you. So yeah,
Yeah.
that's why we have options. And then why do we see significant body composition changes during perimenopause?
Oh, I love this question. And
Mhm.
again, this again goes to why I, one, wrote in the book, but everything goes together, right?
Mhm.
Our bodies are like this fascinating network of like connections and messages. And so when something's down,
Mhm.
the rest of the body like responds to that. And
Yeah.
that's why I like to pull the estrogen and progesterone and testosterone conversation out of the pelvis. I think people
Mhm.
think that estrogen is only for um, uh, reproduction, right?
Yeah.
That's the only thing it's good for. That's the only thing it operates is our pelvic organs. And I'm like, no, you have estrogen receptors all over the body, the brain, the heart, muscle. Same thing with progesterone and testosterone. So as
Yeah.
you start to see a decline, that's why you start to see fat changes in perimenopausal women because of one, how they store their fat, but
Mm-hmm.
also fat cells have estrogen receptors on it. So
Mm-hmm.
the way that fat kind of like whether it regenerates or gets smaller, whether it gets bigger, whether it gets rid of fat, which is like lipolysis, how that whole structure of how fat cells works and adipose tissues work do rely on estrogen. And
Okay.
so when estrogen declines, the ability for it to do what it did before is gone. It migrates. It's like, I think I'm going to make my way up to the abdomen. And you're like, I did not
Right.
ask for you to be here. Who who invited you here?
Yeah. You can go. You are not invited.
You were uninvited, yes, and you're here way too long too.
Yes.
But that's why you start to see some of those changes. And then in addition to that, because we have a decrease in muscle mass
Mm-hmm.
and increase in fat, kind of how it stays around your body because of the
Mm-hmm.
estrogen decline, that's why you start to see this shift in how our bodies appear and it not going away as quickly as we want to, is
Mm-hmm.
because of the estrogen decline. And that's why another reason when women are going through that, I'm like, it's not just for necessarily a symptom of I have a hot flash or a night sweat, but it's
Yeah.
also what is our body doing? Right.
Yeah. Yeah. Because sometimes we can push through a hot flash, but we don't want to deal with the belly fat.
Right.
Yeah. And I had that question across the board, and I deal with mostly women over 35. And, I've
Mhm.
been in this coaching space my entire adult life, and I've seen shifts in my own clients and,
Yeah.
as they come into me, but even as I've worked with them, I'm grateful to have some of the same clients for years, decades.
Mhm.
And just to kind of see this shift. And so I learned through them, and I, try to prepare myself. But even I saw a shift from 38 to 40, from 40 to
Yep.
42,
For sure.
and, and I'm like, oh, this is real. I am not exempt, even though I know things.
Yeah, and that's why I want, again, our conversations to, again, I think the perimenopausal timeframe is actually more important to start these conversations so that you're kind of working in
Mhm.
tandem with the decline rather
Yeah.
than waiting until it declines significantly and then you're kind of behind the 8 ball at that point.
Right. So we have the body weight shifts, and of course along with the body weight shifts comes energy, because you also are more tired maybe in
Mhm.
perimenopause. You also have more body fat, so then you're more
Right.
tired. So there's all of these
Exactly.
things. So I know we need to exercise. Everybody knows we need to exercise.
But do
But
they? Do they know?
yeah, right. Most people don't. If you ask any person, anybody around, if you ask them, I have this conversation all the time. If you say, is exercise good for you? Everybody will say yes.
Yes.
But a lot of people do not.
No.
And I think that's where both of us kind of come in,
Mhm.
because they know a lot of what to do, but then there's the
Mhm.
worthiness and the behavioral part of it. But also it's just kind of feeling like it's pointless. I just can't seem to lose this weight anymore. I'm just not going to do anything. I'll just buy
Mhm.
bigger clothes. What do we do to offset that? Like, are we building muscle? Is that our goal still? Because obviously that's a muscle message, but is HRT going to help something like that?
Yeah, so from an energy level perspective, again, then you also have to think of, remember the other target organs that it
Mhm.
impacts. So the thyroid is an important part of that, right? And so you do see a lot of thyroid abnormalities that occur during a woman's 40s. It's actually,
Mhm.
thyroid is the most common endocrine disorder, and
Mhm.
so a lot of that has to do again with the shift in your estrogen. So thyroid really, again, is important for how we function, our metabolism, our fatigue. And so those changes can occur as well. But also you mentioned a really important one too, is your fat mass starts to increase. Just by definition, in the aging process alone, we will start to move less. Like becoming
Mhm.
sedentary
Yeah.
is
Yeah.
actually a part of the aging process. So you're trying to actually offset that.
Mhm.
And so with a lot of that decreasing muscle, increasing fat, thyroid can be impacted as well. So all of these things together, that's why it's like it's a symphony. It all has to
Yeah.
work together in order for this like perfect concert to happen. And
Yeah.
so when you have like a a trombone that's like offline, and then your drummer is like,
Yeah.
yeah,
It's not
that's where
together.
yeah. So you're trying to keep it in sync, and you're trying to fight some things off, but you're also trying to accelerate some other things as well.
Okay. And as you go through your perimenopause, do those things change? Like, do the dosages change?
Mm.
Are you taking testosterone sometimes and estrogen sometimes?
Mhm.
Okay.
Yeah, I
So,
like to give people options. I would say I do such a variety of hormone replacement therapy here in my
mhm,
office because, again, I am not in charge of someone's life, how they live it, what their cadence is, how busy they are. So I'm happy that we're in the time and phase where we have options to give. When I was training, it really was
mhm.
like a pill. That was
Yeah.
all we had.
Yeah.
And so now we have creams, gels, patches, pellets, injections. And so creating like this lovely menu for women is what I love to be able to do so that they don't feel that they're in one box and they can only, approach HRT from one facet. Going to how we kind of divvy out estrogen, progesterone, and testosterone, I think I always look at what does she come into me for? What is her
Mhm.
main presenting symptom? What is impacting her quality of life and her day-to-day activity? That's how I usually parse out, okay, here's where I might suggest we start with. Then I go into how do you, knowing all the modalities, how would you like to take it? Because
Yeah.
if I offer them a pill and they're horrible at taking pills, I'm like, let's talk about the patch or the cream or a pellet. Like, it should
Yeah.
always be this flowing conversation. There's some women that I have that are not interested, say, whether it's from a symptom perspective or they're just not interested in, say, estrogen therapy. So they'll only be on testosterone.
Okay.
And then you have some women who are like, oh, I'm a little iffy about testosterone, so I really just want to try with my estrogen and or progesterone therapy if they have a uterus or not. And then they leave testosterone out of it. I have a ton of women also who are on all three.
Mm. Yeah. And
So
so
you can
that's
see this variety.
because your ultimate goal, like you said, is to make them feel better, but also kind of
Mhm.
align the symphony to make it all work together.
Correct.
I love
Correct.
it. So is there somebody that's too young to come to you to have this conversation? And is there somebody too old to have that conversation?
That is like one of the best questions you could have asked
Mhm.
because we have, I guess you could say, most often when we're talking about most common ages of perimenopause, then you have our older patients who, because of recommendations in the WHI study, which was a long time ago, the recommendation as it is right now is do
Mhm.
not start anyone on HRT past 10 years from the last time they had a period
Okay.
or over the age of 60.
Mm.
Is that how many of the menopause experts practice nowadays? No. Because
Mm.
if a woman comes in and they're over 60 and they've maybe been on HRT and they want to continue, I do
Mhm.
have a very candid conversation with them, but also allow them, if they would like to continue. And then if
Mm.
you have a woman who comes in after 60 and she wants to start, I think albeit because of this is where it gets a little tricky because of their aging process, even outside of menopause.
Sure.
There are things that happen with our body, and you should know this too. I'm sure you see this all the time, the cardiovascular
Yeah.
implications that come with age. More
I wanted
plaque
you to talk about that. Yeah.
thickening of the vessels. And so now you just have to be very considerate of someone who's coming later. What does their overall health look like if I'm going to put a hormone on top of that?
Mm.
And I think
Mhm.
that's where the conversation should be, but it doesn't mean that they can't start. It just needs to be probably a little bit tighter of a conversation of
Yeah.
how you what your health overall is like, and then what are maybe your risk factors for heart disease in the future.
Yeah. And then what about the too young side? So let's say somebody's like,
Yeah,
oh, I heard about this perimenopause and I'm in my 20s.
yeah.
And then we can relate every symptom to
Yes.
perimenopause. We can do that. We can Google everything and we can either have perimenopause or we could have a cold, so
Which
there's
is
a lot.
which is gonna seem not to a large number, but I think
Mhm.
because of this kind of wave of perimenopause,
Yeah.
there are some times that people will come in and relate their symptom to perimenopause, and I'm like, "You were 18,
Oh,
you're not perimenopausal." So you
yeah.
have to be cognizant of that, and that's why I'm like, it always has to be pulling out and extracting what you showed
Yeah.
up with, what really are some other features in your life that may be causing this symptom, instead of just, like, tagging it, "Oh, it's perimenopausal."
Yeah. No, I love it.
Mhm.
I love that portion too. And I mean, good for the 18-year-old that has an idea of what perimenopause is though,
Exactly,
because
we're doing
yeah,
good work.
yeah, because I obviously had no idea.
Oh, yeah.
So yeah, so that is, good for them to be aware, but then also amazing job as a physician for yourself to sit down
Mhm.
and say, let's continue this conversation as you get older. Great
Yeah,
job understanding, but these are the lifestyle factors, sleep and all of
exactly.
those things that will probably help you more.
Hmm.
Yeah. Yeah. Very, very cool. And so I wanted to talk about your book really quick before we get off.
Yeah.
So your book basically talks about all of the things that we talk about here today.
Yes,
What is
I would say we
perimenopause?
like hit the nail on the head as far as like condensing the book into an amazing conversation.
Yes, awesome. Well, good. And you offer a lot of solutions in there. One last question I wanted to ask you for the exercise component, because Dr.
Mhm.
Jessica Shepard is an avid athlete herself. And
I
she
don't know if I would say athlete. I would just say someone who likes to
athlete.
go.
She's an athlete herself. Everybody who's working out is an athlete. And have you noticed, because I know you have had some conversation and you work with some of your friends and coaches and all
Yeah.
kinds of different modalities. Have you noticed that if you have to exercise differently now going through kind of the perimenopause yourself?
Yes, absolutely. It's like crucial that I changed how I worked out. I used to be someone who was much more of not a sprinter, just like a jogger, I would say.
Sure.
So I would do like half
Like,
marathons, 5Ks, whatever.
we have
But
beautiful long legs, so that probably helps too. Help
yeah,
you.
it was helpful for my pace. I will
Mhm.
say. But what I do know is that muscle mass is impaired by aging, the change in our nutrition, loss in estrogen, and
Mhm.
that has to be the complete understanding for women as they go into, their 40s and their 50s as estrogen is starting to decline, because the health related outcomes are like so. I always think, how do you want to show up later on in life in your 60s,
Yeah.
70s, and 80s? Let's make those changes now, because most times as you get older, you become more frail, cachexic, your bone mineral density decreases to become osteoporotic. And
Mhm.
so it is so important that we look at the loss of muscle function and muscle mass is one of the most important things that we could do now in order to prevent that loss, which is
Yeah.
going to lead to a lot of the reasons why we see women die, such as,
Yeah.
when they break their hip is very, very common. And the risk of mortality after breaking a bone in your older age is actually very, very high. So
Wow.
again, talking about estrogen receptors on bone and muscle is going to be, when you have a decline, impact our muscle mass and then our bone quality. And so with those two gone, you really are not putting yourself in line for success to be stronger as you get older. And that's what you want. You want to be stronger as you get older.
And build that muscle. And that's kind of how
Mhm.
you shifted your exercise as well, a little bit more weight training
And
along with cardio.
not rinky dink weight training either. This
Yeah,
is like
yeah.
your body has the capability to adapt, which is muscles adapt to whatever you would like it to do. And
Mhm.
so as you start to lift, is just being like, I'm not just doing this. I want to build my muscle. So you have to have that eccentric, concentric portion of the weight training that's going to increase and hypertrophy the muscle and make them
Yeah,
big and strong. And so that means lifting heavy. And even
yeah,
if you don't need to do 4 sets of 15, I'd rather you do 3 sets of 8 or 10 on a very heavy weight to build that muscle mass, which is then going to help your bones.
yeah. And you've noticed that shift in your body as you've gotten
Mhm.
old. That's what made you start weight training.
Yeah. Yeah.
Yeah. Yeah.
Absolutely. Yeah.
Yeah, very good. Well, thank you, Dr. Jessica Shepard, for all
Thank
of
you.
your time, and for your book. And again, you have all these solutions and action
Yes.
plans inside your book. And I think we've all been waiting for this book. At least I have.
I'm sorry.
Been waiting for this
So
book.
happy.
Yes, and not only are they in the book, because there's a gazillion books. Let's
Mhm.
face it, fitness
Yeah.
books. Everybody knows there's a lot of books. But you can follow Dr. Jessica Shepard on Instagram, and you can be a part of the community that you've just kind of created in your website.
Yes.
And because that's so vitally important, is to
Mhm.
support the community. So you have the answers, you have the hows, the whys, the options, HRT or no HRT,
Right.
because no judgment, you get to do your life how you need to
Hear
do.
you. Mhm.
And you have all of that in there for us. And we have a community, and go ahead and follow her, and you get to see her doing all of the things. You are incredible. I mean, I know how busy I am, and I know how a practicing physician and all of the things that you do, you are certainly making waves, and I am so proud of you.
I really,
Just
really appreciate that.
and you have young kids and all of the energy. So it is possible. You are walking in your mission, and so happy to support you. I'm going to put all of your stuff in just in the description here, your website, your Instagram. Do you have a YouTube?
I don't actually. It is on when you join the community, we have a
Okay.
YouTube channel. Yes. So yes, I do.
Awesome.
Modern Meno. Modern Meno
Yeah.
was the channel for that. Yes.
Okay, great. So I'm going to link all that here.
Yeah.
Again, thank you so much from the bottom of my heart.
I'm
One
so
of my
glad you
favorites.
can do this, even though you called me out after a whole year.
Hey, you know what? I am a big believer that God has everything happen at the perfect
Yes.
timing.
Timing.
And I would have supported you to the end, even if this
Yeah.
never happened. It
No,
did
I
not
know.
happen, but I'm
I
so
love it.
happy that it did.
And I can't wait till we get a workout in one day together.
Yes, I would love it. So she's in Texas, you guys,
Yeah,
and you have a whole wellness clinic there.
I do. Yeah.
Yes. So
So
if
you
you're
need
out there,
to work out.
you need to go. And I want to make a girls trip and come see you. I have actually thrown that idea out many, many times to a few of my community, and that would be so amazing.
I would love it.
Yeah. Awesome. Well, have a great day. And thank you guys so much for listening. Share this, go follow her, all the things.
And follow you too.
Yeah. Thank you.